طيب the target platelet count في الاي تي بي لما حتعمل brain surgery لازم تخلي platelet count more than 100. طبعا حتى eye and brain surgery platelet count لازم يكون more than 100,000. platelet count لازم يكون more than 50,000 if you are going for major surgery or cesarean section or endoscopic therapeutic surgery. البيشنت حيعمل اندوسكوبي والاندوسكوبي هذه therapeutic endoscopy. طيب معناته المريض يحتاج ايش؟ انه البليتلت كاونت تبعه تكون more than 50. platelet count لازم تكون more than 30,000 for vaginal delivery. Now the definition of non-minor bleed in ITB ما علينا منه. Now when to treat ITB you treat ITB if the platelet count less than 30,000 زي ما قلنا or إنه المريض عنده non-minor bleed عنده intracranial hemorrhage severe mucosal bleed life-threatening bleeding. طيب okay if the platelet in general if the platelet count more than 30 plus no bleeding you don't have to treat. And this is from the American Society of Hematology. طيب and this is class 1B recommendation. طيب now the management of acute non-minor bleeding انه حندي البيشنت IVIG and steroid both of them. non-minor bleeding زي ما قلنا intracranial hemorrhage severe mucosal bleed or life-threatening bleeding. life-threatening bleeding معناته معاه hemodynamic instability. hemodynamic instability معناته systolic blood pressure less than 90. طيب okay now add platelet transfusion لما المريض يكون عنده life threatening hemorrhage intracranial hemorrhage or emergent urgent surgery with low platelet count. Now these are the three infections that we talked about that you need to screen for when you consider ITB diagnosis. Now هذه الأستاذ مرة مهمة إنه متى حتعمل platelet transfusion. When do you transfuse platelets? You will transfuse the platelet لما المريض يكون عنده platelet count less than 10,000 without any complication. Just platelet count less than 10,000 is an indication to transfuse the patient with platelet. عشان تركب central line the platelet count لازم يكون أكثر من 20,000. عشان المريضة تروح إلى vaginal delivery لازم يكون عندها platelet count more than 30,000. عشان المريضة تعمل major surgery ولا C-section اللي هو cesarean section or endoscopic therapeutic procedure لازم platelet count يكون more than 50. عشان تعمل epidural anesthesia إلى البيشنت لازم يكون platelet count more than 80,000. عشان تعمل eye and brain surgery you don't play with the eyes and you don't play with the brain. طيب so the platelet count لازم يكون more than 100,000 if you are dealing with the brain or the eyes. Now if the patient is actively bleeding what do? You should keep the platelet count more than 50 if it is non-brain bleeding, non-CNS bleeding. If it's bleeding in the CNS then please keep the platelet count more than 100,000. طيب this is a summary of the ITB. Now you have a patient comes in with massive bleeding requiring multiple transfusions. What would you expect to see on a blood test? طيب the answer is going to be hypocalcemia. لماذا؟ لأنه multiple transfusion بيعمل لك إيش؟ multiple transfusion بينقل للمريض citrate. When you transfuse blood you كمان تنقل citrate will bind الكالسيوم. citrate will bind free calcium يؤدي إلى إيش؟ hypocalcemia. طيب okay. Now, 37-year-old woman has come to see you because of epistaxis. The episodes have been recurrent and hard to control. She uses no medication. She has petechiae, spleen is not palpable. Laboratory tests show prolonged APTT, normal INR, normal platelet count. What's the most accurate test?